Community information exchange builds networks for enhanced care coordination. Our goal is seamless care coordination that improves people's health outcomes by looking at both mental illness, disease, as well as social support network. Our goal is to work with all of these together and across organizations to understand what it is that a client's experience is. So what CIE aims to do is build a 360-degree client view. The idea is to build the largest real-time exchange with the analytical capabilities to understand the history of what's been happening to a client across various organizations. It'll be used by care coordination and policymakers. We'll provide client history dashboards, we'll help manage trust networks, we'll provide incentives to share and use information, all in the process of understanding new delivery networks and helping funder collaboratives to support CIE-related projects. The goal is building long-term projects, not to fund specific case management systems and not to specifically replace anyone's case management system. What CIE does is really build a network effect. With a single interface, organizations will be able to access many different other organizations' information systems. So the idea is a hub and spoke model instead of a point-to-point interface model. CIE is part of a larger infrastructure of building San Diego's social service network. Starting in the bottom left, San Diego Health Connect is focused on medical records from hospitals, emergency medical services, those types of things. KIP, the Knowledge Integration Project, is the county service, and CIE is providing social service networks. When you combine each of these buckets together, they provide a view of an individual client, in this case a homeless individual. It also links together with 211 for information and referrals. The goal is one person with a more complete view that anyone can access by still respecting all the privacy and security restrictions. CIE was awarded the Innovation Grant in 2011. We've done quite a bit of work since then. I was hired about a year ago. We've filed our nonprofit application. We've done all of the technical work, and we're now ready to go live in July of this year. So let's take an example. Let's assume that there's an individual, Larry, who's on the street. The homeless outreach team and the paramedics team, the ERAP team, has run into Larry, and he says he wants help. It may take up to 2 hours trying to find out if they can find him in bed, how they can get him connected to a hospital. And ultimately, if he isn't able to stay off the street, we haven't really done much to help him. The goal is to understand that client's history so that you can make those decisions much faster, decide to take them to the hospital or to their case manager, connect them with the organizations that know him and know how to help him. Our first cohort of organizations we're linking together are downtown San Diego homeless. These are homeless service providers, it's the emergency medical services and ambulances, and it's healthcare professionals, including a couple of hospitals in the downtown area. Will be used to bridge data across these organizations. And what we hope to learn is how to partner, how partners can benefit from this, what they can understand in terms of the technology needs, what information they're willing to share and what they're not willing to share, and what tools they're needed in order to be able to share. Ultimately, we're going to need to adjust and as we go through this process so we reach greater scalability. So our goal is deliberate and continuous improvement. When we succeed, we want to succeed as fast as possible, and that means we want to fail fast. When we find something that doesn't work, we'll tweak it. When we find something that we should be moving in a new direction, we'll pivot and we'll go in that direction. And when somebody finds an opportunity that we want to go after, we're going to pounce on it. The goal is to transform care coordination. Future cohorts are needed, and if you're an organization that's part of a coalition of organizations that wants to share data among yourselves or across other organizations, please let us know. We're looking actively for future cohorts, and this fall we'll be reaching out. As we think about the criteria we're looking for, we're focused on cohorts that are already working together, where there's some mutual trust, where there's already technology in place so that data is already digitalized, where there's a decent scope of clients and systems, and you have the ability to measure a financial outcome as a result of this. We're also looking for synergy with what CIE has already done. We want to do purposeful experimentation, so we want to move beyond homelessness. We also want to make sure that organizations are working on the timeline that's important to us. So by January, we want to start implementing our second cohort. We want to make sure that folks are ready for that. Ultimately, we want to scale up. We want more clients, more cohorts. because we have relatively high fixed costs, but as we drive the number of cohorts up, the number of clients up, our cost per client will drop. We want more lenses, so more ways of looking at clients, more information about that individual client. What the Alliance has allowed us to do is to have big, hairy, audacious goals. Care coordination across hundreds and even thousands of nonprofits is not a small goal, but we'd all rather try and find out what we learn and see how far we can get. And the Alliance has allowed us to do that, both by having big goals and by taking that first step. What the Alliance recognizes is that we all have plans that look beautiful on paper and in PowerPoint. The reality is messier than that. And having a partner that recognizes that the reality is messy is really critical, because there's been a ton of learning over the last 3 years. And through that learning, that's really where we've made progress. Alliance, like all good investors, knows that you have to both bet on the idea, the vision, and also on the team. And we found that they have done that. They've invited us to various trainings and things that have helped us improve. Because when things go wrong, and things will always go wrong, it's not just the idea, it's not just betting on the horse, it's also the jockey. It's what's the team able to do to adjust. So in summary, the Community Information Exchange is building networks for care coordination. The Alliance has allowed us to dream big, to learn by planning and by doing, to think systemically, to build on others' capabilities, and we ask you, if you want to join us as a future cohort, to please let us know.